there's been mixed reaction after Cabinet approved changes to the adjusted Alert Level 1 COVID-19 lockdown regulations. Among those changes is the decision to reduce isolation periods from 10 days to 7 days for people who've tested positive. Cabinet also announcing that if you've tested positive but don't show symptoms, you don't have to isolate. Should we be comfortable with that? Well, let's bring in the South African Medical Association's chair, Dr Angelique Coetzee, to help us decode what we've heard overnight. And Dr Coetzee, it's always great having you on the program. Thanks very much indeed for making time. I wonder what your broad stroke take is to these amendments. I mean, you and I have spoken in the past, and you've pointed out that testing in this country has always been skewed towards those who are symptomatic anyway. And with that in mind, does this actually effectively change anything?
Good morning, and it is a very interesting developments, of which a lot of them make sense to us from a clinician point of view. So I just need to remind the viewers out there, please, we're still in a pandemic. We're only going out of our fourth wave. We do expect a fifth wave around about May, June. So just to put that back into perspective. So what we have seen with Omicron is that the average patient is around about 3 to 5 days sick. The children around about 3 days. So it makes sense to go back to work 7 days later. But please remember, and I need to ask the employers to take note of this. If the patient are sick, really sick, we are in a position to book that patient off for 10 days or 2 weeks, depending on the symptoms of the patient. But for those patients that are much better after 5 days and want to go back to work, it makes sense to send them back after 7 days. It makes sense not to quarantine someone who tests positive but with no symptoms, as we know that the PCR test can't really, and this is in layman's term, can't really distinguish between life and death viral particles. That's why we keep on saying, please do not test if you don't have symptoms, because if you have symptoms and you test positive, I can assume that you are, it fits the clinical picture and therefore you would be infected. However, no symptoms and you test, and we saw this now with patients that need to travel, or people need to travel overseas with positive PCR tests but not sick, clinically sick, because the PCR will still detect dead viral particles for quite some time after you have been infected. So for those people, it just makes sense for them to go back to work.
Sure. The obvious concern is what happens in a context where I test positive, I don't show symptoms, I infect somebody else who ends up developing severe disease. I mean, I imagine that's where the initial discomfort is coming from a lot of people who are still digesting these news.
Yes, you're absolutely correct. And therefore, the silence on the masks. I know there are scientists that want us to discard the masks, and there's a push to get that, to get rid of the masks. But the truth of the mask is we know that the mask, especially the mask that the public are wearing, will not protect you from getting it. But what it will do, if you are infected subclinically, and remember, this is the realities. If you are infected 2 or 3 days before you start with symptoms, you will just spread the virus less than if you have to wear the masks. We are now seeing with the school sport. Yesterday in my surgery, I saw a lot of school children. Unfortunately, I call it family day because it's a child and the parent that comes in, and the child got it from school sports because it's compulsory to most schools. There's no mask wearing, or they sing, and we all know what happened at school sport. So we have seen a slight increase now from children's side at school functions, bringing Omicron back to their home, infecting the parents. For now, most of the people are vaccinated, but as you correctly pointed out, what do we do if a patient has not been vaccinated above the age of 50 with severe immunocompromised disease or chronic disease? What do we do with those patients? So therefore, the mask wearing is still there.
You speak about vaccinations. In fact, in the statement released by Cabinet, this is what they say. The rationale for these amendments is informed by the proportion of people with immunity to COVID-19, which has risen substantially, exceeding the 60 to 80% mark in several sero-surveys. What does that mean in layman's terms?
So it means that a lot of people had been infected with Omicron. And we know that